Hello, class. My name is Socorro Ramos, and my project is on barriers to healthcare for the Hispanic community. My thesis is to discuss preventable chronic illness among Hispanic people, barriers in receiving proper healthcare, and strategies healthcare workers can use to overcome these obstacles. Some of the preventable illnesses Hispanic people face are type 2 diabetes, which is one of the most common ones. This can lead to blindness from diabetic retinopathy, chronic kidney disease, heart disease, and amputations. This minority group does have a lower rate of screenings, even though they know this can be a risk compared to non-Hispanics. Obesity is also common in Hispanic communities with rates at 47% higher compared to 39% for non-Hispanic whites. Hispanic women also face higher rates of cervical cancer and are 1.6 times higher than white women. This could be due to having a lower rate of cancer screenings and contribute to not being able to have a proper diagnosis. Some of the risk factors contributing to chronic illnesses would be the food environment that the Hispanic community lives in, which is usually a lower socioeconomic due to their immigration status and education status in the US, causing food insecurity and they don't have access to whole nutritious foods. Another reason could be their sedentary behaviors. They can have less knowledge and resources for physical activities. Another contributor can be lower neighborhood community and having fewer social networks that contribute to healthier habits. Family lifestyles are also an important factor into contributing chronic illnesses. Spouses and partners that have um, type 2 diabetes are at higher risk, as well as children are at 20 to 40% higher risk if they have a parent who has type 2 diabetes. It is difficult for Hispanic communities to receive proper health care. Some of the reasons are because the Hispanic community has a lot of undocumented immigrants that do not have access to insurance, or resources that can provide quality health care. Lower socioeconomic status also contribute to not having proper transportation to be able to make their appointments or able to afford their medication. Uninsured immigrants are at higher risk of not having proper health care. There's also been studies shown that not having access to a primary care physician can reduce the screenings that could prevent chronic illnesses. Language barriers are also a negative impact to receiving proper care, as there are limitations in understanding how to take medication or what proper questions to ask their doctors. There can also be misinformation in the Hispanic communities and scare tactics to prevent people from seeking out healthcare due to their immigration statuses. Some of the strategies as healthcare professionals that we can implement for Hispanic patients are being able to give education on diabetes control through lifestyle changes and resources that they can seek to help manage their diabetes or lifestyle changes that we can implement sooner to avoid them having to face this these types of diseases, because once they do have it, it is more challenging to manage. Another important factor of providing proper healthcare is health literacy strategies to reduce misunderstandings and poor communication. In New York City, nonprofit organizations are implementing language lines and translators through videos that can help prevent some of these barriers. Advocating for primary care physicians would also be a great tool because it gives patients access to screenings that can be life-saving. Being able to advocate for our patients and help them understand what questions to ask their doctors can be an important tool to give them. Another important factor that can be hard to seek is free non-federal funded clinics, because if Hispanic people have access to clinics, they have access to having tools that can help them manage their illnesses or prevent it. After this presentation, I hope you gained some insight that the Hispanic community faces when dealing with healthcare systems, which include dealing with language barriers, access to insurance, and lower economic statuses that contribute to illnesses that could be preventable. Through education, advocacy, and lifestyle changes, healthcare providers can provide tools and strategies to help them along the way. Thank you.